Imagine waking up one day, unable to move your legs or even take a deep breath on your own. This was the terrifying reality for millions before the world took action against polio. But what exactly is polio, and why does it still pose a risk today? Stay with us as we uncover the history, impact, and fight against this disease. What is polio? Poliomyelitis, is a disease caused by the polio virus. Most people infected with the virus experience mild or no symptoms. However, in some cases, polio can lead to paralysis or even death. There are three variations of poliovirus called wild poliovirus type 1, 2, and 3, WPV1, WPV2, and WPV3. Wild polio types 2 and 3 have been eradicated, no longer exist, and wild polio type 1 only exists in a few parts of the world. Polio type 1 is most likely to cause paralysis. Types of polio. Polio affects the body in different ways, depending on where the poliovirus spreads. The main types of polio include abortive poliomyelitis, the mildest form, causing flu-like symptoms and intestinal issues. It lasts only a few days and does not cause long-term problems. Non-paralytic poliomyelitis can lead to a septic meningitis, swelling around the brain, causing more severe symptoms than abortive poliomyelitis. Hospitalization may be needed. Paralytic poliomyelitis, the most severe form, where the virus attacks the brain and spinal cord, leading to muscle paralysis. It can affect breathing, swallowing, and limb movement. Paralytic polio is further classified into spinal polio, affecting the limbs; bulbar polio, affecting breathing and swallowing muscles; bulbospinal polio, a combination of both. Less than 1% of polio cases develop into paralytic polio. Polioencephalitis, a rare form that mainly affects infants, causing brain inflammation. Post-polio syndrome, PPS, a condition where polio symptoms return years later, affecting muscle strength and mobility. How does polio affect the body? Poliovirus enters the body through the mouth or nose and multiplies in the throat and intestines. In some cases, it spreads to the brain and spinal cord, leading to paralysis. This paralysis may affect the arms and legs, muscles that control breathing, muscles needed for speaking and swallowing. Who is at risk for polio? People at the highest risk include those who aren't vaccinated and live in or travel to areas where polio is still present. Live in places with poor sanitation. Are under 5 years old. Are pregnant. Can adults get polio? Yes, adults can get polio, but many are protected due to vaccination or past infection. However, unvaccinated adults can still contract poliovirus if exposed. Symptoms of polio. Most people infected with poliovirus do not develop symptoms. Between 70% and 95% of cases are asymptomatic. Among those who do show symptoms, the majority experience mild, flu-like illness, abortive poliomyelitis. The most severe form, paralytic polio, can lead to permanent paralysis. Symptoms of abortive poliomyelitis. Abortive poliomyelitis causes mild, short-term symptoms that appear 3 to 7 days after infection and last only a few days. These include fatigue, fever, headache, vomiting, diarrhea or constipation, sore throat. Symptoms of non-paralytic poliomyelitis. Non-paralytic polio begins with the same symptoms as abortive poliomyelitis, but progresses within a few days to include neck stiffness, pain or tingling in the arms and legs, severe headache, sensitivity to light, photophobia. Symptoms of paralytic poliomyelitis. Paralytic polio begins with symptoms similar to the milder forms, but can worsen over days or weeks. Additional symptoms include sensitivity to touch, muscle spasms. Paralytic polio can be further classified into spinal poliomyelitis. Causes paralysis in the arms, legs, or both. Bulbar poliomyelitis affects muscles needed for breathing, swallowing, and speaking. Bulbospinal poliomyelitis, a combination of spinal and bulbar polio symptoms. Symptoms of polioencephalitis. Polioencephalitis can occur alone or alongside flu-like symptoms. It primarily affects the brain and can cause extreme tiredness, fatigue, anxiety, difficulty concentrating, seizures. How does polio spread? Polio is a highly contagious virus that spreads through 1. The fecal-oral route, when traces of an infected person's poop enter the mouth. 2. Respiratory droplets, through coughing or sneezing. Ways polio can spread: not washing hands after using the bathroom or changing diapers, drinking contaminated water or swallowing it while swimming, eating food that has come into contact with contaminated water, swimming in infected water, especially if someone with diarrhea has been in it, breathing in droplets from a cough or sneeze of an infected person, close contact with someone who has polio, touching contaminated surfaces, and then touching your mouth. Prevention tip: wash your hands regularly and ensure you're vaccinated to protect yourself from polio. How is polio treated? There is no specific medication to cure polio. Treatment focuses on managing symptoms and preventing complications. If polio causes paralysis, physical therapy is essential. In severe cases where breathing muscles are affected, a mechanical ventilator may be needed. Ways to improve symptoms include drinking plenty of fluids, water, juice, broth, using heat packs to relieve muscle pain, taking pain relievers like ibuprofen, Advil, Motrin, following a physical therapy plan prescribed by a healthcare provider, getting enough rest. Is there a cure for polio? No, there is no cure for polio. The virus must run its course, and there is no way to speed up recovery or prevent paralysis once infected. Polio prevention. How can I prevent polio? The best way to prevent polio is through vaccination. Polio vaccines are typically given in childhood, but unvaccinated adults can still receive them. Recommended polio vaccination schedule. For children, the standard vaccination schedule includes 4 doses. First dose, 2 months old. Second dose, 4 months old. Third dose, between 6 and 18 months old. Booster dose, between 4 and 6 years old. For adults who have never been vaccinated and need protection, the schedule includes 3 doses. 2 doses given 1 to 2 months apart. A third dose given 6 to 12 months after the second. Who should consider a booster dose? A booster shot may be recommended for adults at higher risk, including those who travel to areas where polio still exists, work in a lab handling poliovirus samples, work in healthcare, and may be exposed to poliovirus. Polio eradication, an overview. In 1988, the World Health Assembly launched a global mission to eradicate polio, leading to the creation of the Global Polio Eradication Initiative (GPI). This initiative is led by national governments, the World Health Organization (WHO), Rotary International, the U.S. Centers for Disease Control and Prevention (CDC), and UNICEF. Later, the Bill and Melinda Gates Foundation and Gavi, the Vaccine Alliance, joined the effort. Thanks to global vaccination campaigns, polio cases worldwide have dropped by 99%. In 1988, there were an estimated 350,000 cases across 125 countries. Today, polio remains endemic in only 2 countries, bringing the world closer than ever to eradicating this disease, something that has only happened once before, with smallpox in 1980. Thanks to decades of global effort, we're closer than ever to making polio a thing of the past. But the fight isn't over yet. Every vaccine given, every awareness raised, brings us one step closer to a polio-free world. Let's continue protecting future generations because together, we can end polio for good.